When is a TIPS procedure used for esophageal varices? Imagine a situation where someone with liver disease suddenly starts bleeding from their esophagus. This can be life-threatening, and doctors need quick, effective ways to stop it. A transjugular intrahepatic portosystemic shunt, or TIPS, is a procedure that can help in these urgent cases. But when exactly is it used? TIPS is mainly reserved for situations where esophageal varices, which are enlarged veins in the esophagus caused by high pressure in the portal vein, start bleeding and do not respond to usual treatments. These treatments include medications like beta blockers that lower blood pressure in the veins, and endoscopic procedures such as band ligation or sclerotherapy that aim to control bleeding directly. If these methods fail to stop the bleeding, or if the bleeding keeps coming back despite repeated efforts, a TIPS might be considered as a rescue option. Another key situation is after an initial bleeding episode from esophageal varices. The risk of rebleeding is quite high, often over 50%, especially if medications and endoscopic treatments don't work well enough. In such cases, TIPS can be used as a preventive measure to reduce the chance of another bleed. It is also sometimes used when patients have recurrent bleeding episodes, making it a first-line option to prevent further hemorrhages. In addition, TIPS can serve as a bridge therapy before liver transplantation or certain abdominal surgeries. When portal hypertension is severe, and there is a risk of bleeding during surgery near the stomach or esophagus, creating a shunt with TIPS can lower the pressure and make surgery safer. The way TIPS works is by creating a small channel inside the liver that connects the portal vein, which carries blood from the intestines, to one of the hepatic veins that drain blood back to the heart. This reduces the high pressure in the portal system that causes varices to form and bleed. While TIPS is effective at controlling bleeding and preventing rebleeding, it is not without risks. It can lead to complications like hepatic encephalopathy, which is a brain dysfunction caused by liver failure, and other procedural issues. Because of these risks, doctors usually reserve TIPS for patients who have failed less invasive treatments or who have severe complications from portal hypertension. It is important to note that TIPS is not used as a primary prevention method. Most patients with esophageal varices do not bleed initially, and bleeding can often be managed successfully with urgent endoscopic therapy. The decision to use TIPS depends on individual patient factors, including the severity of liver disease, the risk of bleeding, and how well other treatments are working. In summary, TIPS is a valuable tool in managing esophageal varices when bleeding is severe, recurrent, or unresponsive to standard treatments. It plays a critical role in controlling complications of portal hypertension, especially in patients with cirrhosis and advanced liver disease. Always remember, the choice to perform a TIPS procedure should be made by a liver specialist, weighing the benefits against potential risks, and tailored to each patient's unique situation. If you or someone you know has liver disease and esophageal varices, consult a healthcare professional for personalized advice and management options.